invitation of Congressman Larson to meet with me and the Lieutenant Governor, as well as Jeanette DeJesus. Lieutenant Governor and Jeanette are doing, I think, wonderful work on getting Connecticut ready to fully implement our new federal law, which is only a year old. And we actually firmly believe that Connecticut, as I've said many times, can play a leading role in developing this new system in the United States. We are availing ourselves of every dollar that we can go after to make sure that we are putting that system in place, including the technology necessary to be compliant. Dr. Berwick and I, and along with the group that met in my office, I think had a good exchange of ideas on reminding us that the state of Connecticut can play a leading role not only in implementation, but also in finding effective strategies to make that implementation cost effective and to lower the effective cost of health care. And that's something that I'm very interested in doing. But before Dr. Berwick speaks, my friend John Larson, who was kind enough to arrange for this meeting, has a few things to say, and I'd like to turn it over to John, Congressman.
Thank you, Governor. Well, thank you, Governor, and I'd also like to join with him in echoing the outstanding job that our Lieutenant Governor, Nancy Wyman, and Commissioner DeJesus are doing with regard to health care. It was certainly enlightening and informing for Dr. Berwick and I to hear about the great strides that Connecticut is making. What an honor it is for us to have a Connecticut native in our presence today, someone whose background is extraordinary, to say the least. Someone who, with regard to being in charge of overseeing both Medicaid and Medicare and the Children's Health Program, commonly known as CHIP, basically is responsible for 1 in 3 of all Americans and has an $800 billion budget. Clearly, in Washington, we are supportive of the Affordable Care Act that has provided so much for all Americans. It's so important for our implementation, and that seamless implementation with states is vital. And I commend the Governor again for the opportunity to meet with them and talk about the opportunities that will exist for us. It was not only the Governor that we met with today, but also the opportunity to speak with our hospitals, with our doctors, and with the industry here in Connecticut as well. We are blessed and fortunate as a nation, but especially as a state, to have somebody with the capability of Dr. Berwick running this office. And without further ado, let me introduce him. It was an enlightening day. Clearly, this country has a path that we can proceed on. There are those that believe that the path forward is just to cut our way to the bottom in savings, or to invest and provide opportunity in better health care. That's what Dr. Berwick was here today to talk about. I'm proud to say how all of Connecticut, especially those that we met with today, came together around an enthusiastic path forward. Dr. Berwick.
Thank you very much, Congressman Larson, and I want to thank you for your leadership in this exciting time in American health care. We're really headed to a much better care system, thanks in large measure to you and your colleagues who are beginning to show us the way. I want to thank the Governor, Lieutenant Governor, Commissioner, and all of you for the chance to visit with you here in my home state. I grew up in Moodus, Connecticut. My father was a general practitioner just down the river from here for my whole childhood, and I feel very loyal to this state, very excited about what's possible here and proud about what I've heard. As you've heard, I've met this morning with leaders from the hospital community, physician community, other leaders from the state, as well as policymakers. The potential here is phenomenal. I would love to see Connecticut emerge as a prototype for truly better care that our country needs in a more sustainable, at a sustainable level. In CMS, where I've now been 9 months, the rubric that we're using for our goals are a 3-part aim: better care, better health, and lower cost through improvement. That's lower cost not by withholding care from people who need it, but by devising an American healthcare system far more oriented toward meeting the needs of the people who depend on it, and far more integrated and satisfying both for the people who get care in it and those who work in that system. here in this visit, I was struck, as I often am now around the country, by the readiness. If you'd been in the room with me with the hospital leaders, the physician leaders, and the others, you would have heard what I'm hearing in a lot of places now, which is, it's time, how can we help? Everybody seems really now to understand that the time has come for us to move toward the system that we want. Better for patients, oriented toward providing health and at a cost that can be sustained. I am pretty excited what's possible at the state level. Already in the state, you have a track record of some tremendous gains. The Hospital Association was reporting to me today, for example, on progress against certain kinds of infections in hospitals. An 80% reduction, for example, in this state, in central line bacteremia infection. That's a very important kind of infection that can kill people. And you're approaching as a state the opportunity to potentially eliminate it. That's just one little example about what I regard as the better plan for American health care. As a congressman said, there's a lot of talk now about trying to make health care sustainable by cutting it, by reducing things, by taking away Medicaid and Medicare benefits from the people who need them the most, by putting the burden on the shoulders of people who can least bear those burdens. I'm not for cutting. I don't think that's the right way to get there. I think a modern, mature, confident, optimistic nation can find its way toward what we do in every other area of products and services, which is better designs. The computers you use today, the telephones, the airplanes you fly in are better than they ever have been before, and generally at lower cost. We can do the same in healthcare by improving the healthcare system to better meet the needs of patients and families and communities. We can arrive at the system we all want: better care, more seamless care, more oriented toward prevention, and at a much more sustainable cost. We have examples of that all over the country. Now I think it's time for us to build those examples into the normal care system, make excellence the norm. I think that's possible in this state, and I'll do everything I possibly can from my position at CMS to help this state achieve the kind of care system I know that you and your citizens want.